Glad to know you're still tuned in to Souq News Television. European health authorities have issued a travel warning to European countries, especially for visitors from countries affected by monkeypox virus. And this is coming on the heels of an emergency declaration by the World Health Organization, declaring it an emergency, general pandemic, so to say. Of course, a monkeypox virus, similar to smallpox, has been making a resurgence globally, while cases have declined in many regions. Africa, particularly Nigeria, has seen a steady increase, and the World Health Organization has expressed concerns about the outbreak and a potential further spread. Of course, in the studio with me is my partner in progress and shaping policy, together trying to advance development. Blessing Ihiche. Good morning.
Good morning, Temple. How's your morning coming on?
Great, great.
Okay, I'm sure it's to get better when we get to find out what's happening with the resurgence of the monkeypox outbreak in Nigeria and some of the parts of the world and what one can do to prevent it. So the fears that are building up in some people would be allayed.
Well, we've noticed an increase, a steady increase with deaths recorded at about 517 that's recorded across
Globally,
Africa and over 2,000, right? But then the highest numbers have come from Nigeria. And it's just
the highest number of confirmed cases, you mean?
exactly, yeah. So it's rather, I don't know how to describe it, scary. I
It
mean,
is
for
scary.
some people who hear about it, and then it's much worse because while a few persons are aware, some persons are not conscious of what the symptoms are. They're not aware of what the mode of transmission is, and how you can contract this. And so, I mean, it's imperative that we bring it up and get to have an expert bring us up to speed with transmission, mode of communication of this, and how we can manage it.
Hmm. Talking about experts, we did have an interview yesterday with the CMD of Era Specialist Teaching Hospital, Edo State, who was present at the ongoing Africa Development Studies Center and National Institute for Policy and Strategic Studies training yesterday. And he did say some things about monkeypox. Let's get a listen of that and then we'll continue the conversation. Right, communication from our producer says we'll get to listen to that much later. In the meantime, we have a specialist and experts that will be joining us on the conversation. NTC will bring him in.
Well, Dr. Polycarp Salam Samson, he is a director of veterinary medicine. He also holds a Master of Science, FCVSN. He is a US CDC CSM project implementation officer and an African Field Epidemiology Network. Glad to have you on the program, Dr. Polycarp Salam Samson.
My pleasure. Thank you. Good morning.
Okay, let's start off with the similarity of monkeypox and smallpox, and would want to ascertain if this is a lot more deadlier than its compadre, if I may, smallpox.
Okay. Thank you very much. So the similarities is just simple. So they belong to the same family. The family is called Poxviridae. The genus is Orthopox virus. So it's the same family. Little wonder why they use vaccines that are though for smallpox, you understand, for this infection, the Mpox. But however, I need to mention that it's not a pandemic. Yes, the alert has been raised as a public health emergency of international concern because there's a new strain, right? Before now, it was strain clade 1 and strain clade 2 in West Africa and in Nigeria. Clade 2 is the circulating strain, right? The difference is quick. The one circulating in Nigeria, if you notice this year, we've had like 39 confirmed cases, no mortality, meaning none has died because case management seemed to work for that, right? However, The new strain is called clade 1B. It's not been reported in Nigeria. I'm not sure. I'm not working with the NCDC. But as far as I know, as an epidemiologist, it's not been reported. So this strain is more virulent, meaning it's deadlier. You gave the statistics. Out of 2,800 and about 63 cases that have been confirmed in Africa in 13 countries, 517 have died, right? So if you do the maths, the case fatality rate is 18%. The last outbreak we had in 2022, globally, the case fatality rate was about 0.2%. So it gives you an insight of what we're facing. And so it's not in Nigeria yet, but NCDC are doing a couple of things. They've responded with high alert at entry points, the airport, at the seaport, land border. There's high alerts that has been raised. Then, of course, they've also activated active surveillance in most of the states, including the commercial hub, Lagos, and of course, the capital, Abuja. Thank you.
All right, doctor. I know that one of the ways of controlling the outbreak of such disease, whether it's Mpox, whether it's Ebola or the likes, is contact tracing. Since 2022, there hasn't been an outbreak of monkeypox, at least globally, to the knowledge of many people in this magnitude. What could you say, or where could you say this particular strain that is quite new and has not been in Nigeria before came from, and what can be done to ensure that it doesn't continue to spread, even as there are measures to ensure that the borders and other areas have been watched? Or their surveillance?
All right. So it's important to understand the concept of zoonosis. So zoonotic diseases are diseases that could be transmitted from animals to humans. Okay. So Mpox is a zoonotic disease. So it's believed that the ancestors or the animals harboring these organisms, these viruses, are the rodents and monkeys, right? So it's difficult to say that you can control that. However, you can control it from the human perspective, like contact with this animal, be it hunting, be it consumption, you understand, just basic contact with this animal. So Democratic Republic of Congo has always been in the picture since 1970, okay? They've always had cases of Mpox, okay? So it's not like it's a new thing. What is coming new is that it's no more the clade 1. Now it's the clade 1B. Now, the concept now is you have diseases that have existed. They are coming, we call them emerging diseases. However, you have those diseases that are completely new that you are not prepared for. There are new diseases. They're just, they're imagined, they are not reimagined, right? So what you do there is, because there's little that you know about it, but however, you're lucky that clade 1B is also from that same family, okay, that's called pox viridae. And if there's a vaccine, the problem is the vaccine is not even in adequate quantity that would go around. Okay, that's one of the public health challenges. But then it's a new strain because sometimes it goes through genetic drift and shift over time. When that happens, the morphology, the pathogenicity, it changes. It's just science. There's nothing you can do about it.
Evolution did take place, and of course, some form of mutation, just trying to sound as intelligent as you, doctor. But then, if I may, the symptoms, how can one know he has monkeypox? Because pictures of the internet show, some sort of wells and all that on the skin, the hands and all that. How can one know he's contracted monkeypox, and how can one contract this disease?
Okay, so very important question. So first off, the symptoms, it could just start with a simple sore throat, okay, chills, increase in temperature, we call it fever, right? Those are just the first phase. But then the classical presentation is you see the rash-like symptoms like pimples. It starts from the face, okay? It's also visible in the buccal cavity in the mouth. Then it starts spreading to extremities, to the palms, starts spreading to the soles of the feet. It's also classical on the chest, right? It could be all over, but these places I've mentioned are the probable first places that you see these rash-like pimples. The unfortunate thing is that this pimple, they graduate. The macules graduate to papules, papules graduate to even pustules, and it would rupture. So it becomes like an open wound. Now, it's no more Mpox that you're dealing with. Secondary bacterial infection. Now, regarding or depending on the bacteria that has infected the open wound, the sequelum differ for each individual, right? You can contact Mpox, one, through close contact with humans, two, through close contact with animals, and three, through contaminated inanimate materials. For example, beddings, clothing, handkerchiefs, any inanimate object that has been contaminated from or by an infected human or animal.
Now you mention animals, it becomes scary to have animal protein, which a lot of us love. And we have abattoirs, we have places where people go to purchase beef and some other things so that they can add to their food. What can be done in places like that? You said this can be traced to monkeys and rodents, but when we say animals, it's like there's no particular animal that is excluded from the list of animals that could have been contaminated. What do we do about our markets, our abattoirs from where we get animal protein?
Oh, okay. Thank you very much. So I don't want to go into discussion on abattoir. Reasons being that first off, we don't have abattoirs for monkeys, right? Not in Nigeria anyway, to the best of my knowledge, monkeys and rodents. Okay, so it's just like the case of Lassa fever, right? It's been transmitted, or the consistency of the reservoir, it's in a rodent. So similarly, we're saying that Mpox, the reservoir, the ancestors, they are being found in both rodents and monkeys. It hasn't been reported in most of the other animals or other species of animals, or maybe researches have not been conducted, you understand, to find out. Research would beg because there were symptoms that as though look like cowpox. Okay, so there are instances of cowpox, which is also part of the family. Okay, but the virulence is not like what we are, and the transmission has not been confirmed that it can be transmitted or is zoonotic. However, Mpox is the one, just like smallpox, that we're lucky that we've eradicated. Okay, and just to mention, it's not like it's a whole new infection or evolution that we're seeing. Sometimes there's underreporting. So there probably has been these infections that have been underreported or not reported because they have not been picked. It doesn't mean they've not been existing. They probably have been existing in very small size that have not exceeded the expected. Now, when the observed exceeds expected, that's when you have an outbreak. However, in countries where they've been experiencing it and it's been consistent over the years, it's not an outbreak because it's something they can manage, right? It's an outbreak now, and it's an international cry because it has visited new areas where as though has never been reported. And hope you know, we have, I read yesterday, we have a case in Sweden. And from history, it was traced that the patient had visited the African country where one of these clade 1B infection has been reported. So It's all here in Central and East Africa. Okay, in Nigeria, well, we've not reported clade 1B.
Well, a little bit gory for my partner, Blessing, this morning, and well, we'll manage to keep up with you, Doc. Well, then you've talked about the fact that these diseases have been here over the last century, monkeypox, smallpox, but I'm more conversant with chickenpox. And, like the way they say, okay, if you've had chickenpox, if you've suffered it, your body becomes immune to it. And I don't know, I need you to confirm that chickenpox can be suffered twice in a lifetime. And if that is the case, can that be said of monkeypox? Does the body become immune to this, having had to live through it? You've had the disease and then you get better. Do you now become immune to it, or is it something that in the near future, you could become sick of it again?
Oh, okay. So if you permit me, I will just generalize. So because it's the same concept, is the concept of immunity. Okay. So two things: immunity can be naturally acquired, can be artificially acquired. Artificially is where vaccination, right? Naturally is a crude way of acquiring immunity, and that is in a population. Okay, infection will come depending on the pathogenicity or virulence, meaning depending on the seriousness of this disease. The people that are susceptible will die naturally, and people that do not die, that recover from this illness, they're expected to have built antibody against this particular infection. Going forward, if this infection visits the same host, it's not expected that it's going to come down with the same severe clinical signs that it has presented the first time it visited the host. However, it might present very mild clinical signs. So it's a general concept of immunity.
Hmm. So let's get to treatment now of the monkeypox. But before that, if you watching, talking to viewers right now, you notice that some of the pictures of the physical manifestations of the monkeypox might be gory. Viewers' discretion is advised at this point. We know that it might offend some person's sensibility, but it's just that we need to show you a bit of what it looks like when someone has monkeypox. Away from that, get into the treatment now. Earlier, we've talked about the vaccine being inadequate in terms of supply, but the vaccine for smallpox is being used. What would you advise? A mass vaccination to prevent people from contracting the monkeypox? Or what would you say would rather prevent? How much of prevention can be done without vaccination?
Okay, so without vaccination, I think the NCDC, they're on the right course, because that's what is expected. The first thing is you don't want any of these cases visiting your population because it's easily spread, right? So the first thing is the DG and CDC have confirmed that they've raised a high alert level at all ports of entry. As a matter of fact, for flights that are visiting those countries that the infection has been ongoing for the past 90 days, they have to complete or fill in a declaration form, you get. And of course, surveillance. Surveillance is very important. You talked about contact tracing. So yes, they've been doing that. That's why they can confirm that only 39 cases have been reported in Nigeria as this year. So I feel the NCDC actually they have a technical working group, and this technical working group is a One Health concept. They're not just sitting at the NCDC folks alone. They're incorporating ministries of environment. We talked about the rodents and the monkeys. They're collaborating also with Ministry of Agriculture, okay, that are believed to be the head of animal population. So I think they're taking steps in the right direction. So for now, I think the best is the prevention, because like I said, the vaccines, even if they are available, they are not available in adequate doses. And what you'll be doing in terms of infected population when you're vaccinating is not the usual vaccination. It's called reactive vaccination, okay? So I know, I'm aware that like about 10,000 doses would be supplied to Nigeria, but it hasn't arrived. How we're going to distribute it, or the population that are going to be chosen. Of course, the epidemiology is more in some parts of Nigeria than others, right? So I believe that even if those doses come to Nigeria, it's most likely that those states are the likely beneficiary of these doses that are going to be received in Nigeria.
So you mentioned a case in Sweden, and you said it's possible that I don't know if you're certain that that has been confirmed that the person visited Africa. But then, what does this portend for travel and migration, especially from Africa, where we have a high number of cases, to European nations and the rest of the world?
Yeah, so for the European Union, and of course the EEA, the European Economic Area countries, they have issued out an advisory to all the citizens that they should be aware. Of course, they know the countries that this new infection or this new strain have been reported. And because of the virulence, it's their responsibility to inform the member countries that visiting these countries is to your peril. So I think for now, what they're trying to do is to, of course, it's going to interfere with the economy, it's going to interfere with business, but you have to be healthy to conduct business, right? One of the control measure is in those countries, just like in Nigeria, there's a high alert, meaning when you arrive at any of the ports, air, sea, land, there's going to be proper. So, and if you're arriving from these countries that this new strain has been reported, you have to be isolated. You have to be isolated and observed for some certain period, up until when they believe the incubation period must have completed and you're not coming down with symptoms. Then you are cleared to go into the population. I think they're taking steps in the right direction. It's going to affect the economy, but they're going to stay healthy.
Staying healthy, whether or not you've contracted monkeypox, should be a priority at this point, I believe. And that's what healthcare workers are doing. Kudos to all of you. For treatment of those who have contracted the monkeypox virus, is it possible
Oh,
for
yeah.
one to be treated and then they become well again? No trace of monkeypox infection in them.
Oh, so that's very, so, it's just basic science. For most people that have contracted monkeypox before, it's less likely for them to contract it with the same severity as though a new person is contracting, right? So I wouldn't say they would never contract monkeypox again, but even if they do, it's not expected to come with the same severity as new people that are contacting the virus for the first time. So for treatment, it's a bit tricky. Like I said before, the general concept about viral infection is they're mostly self-limiting, meaning they ought to take their course before the person heals. Unfortunately, the person might die if you leave the disease to take its course. So what we do in case management, or what's been done, even if there's an antiviral drug, because of the secondary bacterial infection, okay, it's advised that case management is symptomatic. So there's a secondary bacterial infection. You want to give broad spectrum antibiotics because you don't know which specific group of bacteria that have infected those open, the papules, when they become blisters, there's contact everywhere. And that's why I said one of the modes of transmission is inanimate materials, because once this become an open wound, you're lying on beds, so the bedsheet is contaminated. You're touching doors, the handles are contaminated. You're touching spoon is anything you touch is contaminated. Okay, so broad spectrum antibiotic is what is being supported. A lot of hydration, a lot of topical antibiotic supportive treatment. That's what is being done. I think it has worked pretty much, especially from infection that has to do with the clade 2 that we're experiencing here in Nigeria.
Well, I mean, it's just so much to deal with. The fact that we do not have like a permanent solution to it. And of course, if we were to ask what can be done to keep this at bay, to manage so that, we limit the spread and not contract this disease, what would you be advising? Also, considering the fact that you had mentioned that, it's going to take a toll on our economy. Of course, the impact is going to have on tourism and influx of people when they need a foreign exchange, and then you have a situation where travels will be limited. Also, will take a toll on the effect that the funds that could have come in through foreign exchange would have on the economy. But then, how can this be managed? What can be done? To keep safe. I mean, at the time we had COVID-19, we had Ebola, as a practice of safe distancing, washing your hands regularly, and a lot more. And you've mentioned the fact that these are in cycles, is in stages, from the point when it looks like a pimple, it gets to a pox, it busts open, it's now an open sore. So there are different stages to it. And of course, at every point in time, is it that you can't be infected at every stage of monkeypox, or just when it blows open? And how can we, keep safe and manage it?
The basic way, it sounds funny every time we say that. One of the ways is avoid eating bushmeat, right? It's like a cliche, but it's true, because most of these zoonotic diseases, they come from these bushmeats. Okay, it's not just eating the bushmeat, it's the processing. How properly processed do they get? Okay, so you eat them, you just harbor them, and an evolution, I'm using your word, just an evolution of a new infection now comes. So one of the chief ways of prevention is avoid eating bushmeat. Secondly, IPC, just like in Ebola and in COVID-19 now, IPC is very important. The simple washing of hands, the simple using of hand disinfectants, the simple distance from individuals that you're not sure of. So it's in all diseases. You don't have to see someone with skin rashes or skin lesions before you say you want to distance from that person. The government is doing the right thing, okay? These stages that they've mounted, it means that because there's an active surveillance from the community level up to the national, we're likely to pick any, and trust me, once a case is picked, the case is being rushed to the reference lab. That is where the morphology of the clade is being carried out. So I'm sure that whenever we have a clade 1B, I'm hoping we don't, but if we do, I'm sure the alert is going to raise, and NCDC are going to give some guidance, some steps that Nigeria are going to go forward or move forward towards in communication, in the way we interact, the way we go from one place to the other. But basic distancing, and it's even difficult when you come to IDP camps. If the infection gets to IDP camp, how do you distance people? Understand? There's close contact. So for now, it's just preventing it from coming to Nigeria. Okay, and the government are doing the right thing at those ports of entry.
All right, we'll come to doing the right thing, and what are the right things exactly? Are they limited to all you've mentioned? for now. But let's get a clip of the interview we had with a colleague of yours who happens to be the CMD of Area Specialist Teaching Hospital when he was interviewed on the monkeypox outbreak.
That we have 2 new cases of Mpox in my hospital. So, whereas about 2 or 3 weeks ago we don't have any, but right now we have 2 confirmed cases of Mpox. It's a disease that is with us. I don't many people know more about it. I've already had the community health department to create awareness so that many people will not be affected about the disease. I'm a nutrition and gynecology. One of our papers we published is Mpox in pregnancies. It's online, and I was opportunity to develop how people who are pregnant with Mpox, how would they be delivered to prevent mother to child transmission. It's well written and it's actually available. It's published in the Major Infectious Disease Journal with a group of all Nigeria. I think that's one of the first papers in Sub-Saharan Africa, and we did that. So, NCDC is doing its own. We're also doing ours to help the country to make sure many Nigerians are not really affected.
All right, that was the CMD of Area Specialist Teaching Hospital there talking about the prevention and treatment as well as control of the monkeypox outbreak. He mentioned one thing, prevention of transmission from mother to child when you have the monkeypox infection in an expectant mother. But let's get to the right things first that we were talking about. So, at the moment, the NCDC is trying to prevent the new strain of the monkeypox virus from coming into Nigeria. And until that gets to the country, not much work or not much will be done regarding the physical distancing of people that we saw during the COVID-19 pandemic. Don't you think we should be proactive rather than expect to have a case of the new strain before enforcing those strict regulations to ensure that the monkeypox infection doesn't spread? What are your thoughts on this?
Oh well, so you know the thing with COVID-19, it came with a lot of economy shutdown, economic breakdown, and so I just think why they're a bit skeptical or why they want to instinct stricter measures is because they just want the economy for now to flow. I mean, we just came from protests, so there are lots of things going on in Nigeria, right? So I feel that, just like you said, very correct, we should be proactive, not reactive. Okay, that's what is expected. However, like I mentioned again, I said, so far in West Africa, not just in Nigeria, in West Africa, most of the clade that has been reported is the clade 2. The clade 2 is less virulent. Case management mostly suffices. If you have 39 confirmed cases and none of them is dead, it means your case management is very effective, right? So for economic purpose, public health cannot work without economy. They go hand in hand. So people analyze what are the economic benefits of every instruction we're going to give. All right. So I don't think we've gotten to that level. I'm sure when we get to that level where they need to instill stricter measures or controls, I think we'll get to know. But for now, I think we're safe. I think for now, if our borders, if we have surveillance officers at each of our points of entry, okay, take history of persons that are coming from countries that this infection have been reported or this new strain has been reported, if we can isolate or quarantine them until when they don't present the clinical signs before we introduce them into our population, I think we're safe. It's just basic epidemiology. Thank you.
Well, doctor, let me sound like you again. Some of these diseases are asymptomatic, right? But the good thing about this one is the fact that, I mean, you start seeing the boils and then at some point, like a cherry pops open. But how about if someone comes in with a strain, sips through the border? Because if I take your mind back to the case of Sawyer, I think during the Ebola era, he was a foreigner. Well, foreign to Nigeria. He was not a Nigerian, and as such, we understand how the system works. Not to want to, let me pardon it a little bit. Some foreigners may be giving some sort of you know where I'm going to with this. And then you come in, you have a strain, you're asymptomatic, and then gradually it's just all about the system. But then how do we make people who have discovered that they have the symptoms or they've been infected come forward? You've talked about surveillance officers, but then how do we encourage people who have got the symptoms to come forward and be treated, especially when we have a healthcare system where, I don't know if the federal government has put some sort of measures in place where people who are infected can be treated free of charge, because, that is also an issue. You come in and you're feeling like you might not be giving the desired attention, and the other hand, you might not be able to afford the cost of healthcare and all that. So it's just all bundled into one, and I wonder what you make out of it.
Very correct. Very correct. You made lots of points, and I agree with you. Okay. The project I'm working on, the cerebrospinal meningitis project, right? They have in every state, they have a reference hospital that if patients with CSM are referred there, they get free treatment, ceftriaxone, fluid therapy, and all that free treatment. And of course, just like you said, it encourages these patients, even when they don't come forward. Of course, surveillance officers will pick them and advise them, because most times these patients don't even know, not like in cases of monkeypox, like you rightly say, that the lesions are obvious. So I feel that just like CSM, if we had reference hospitals for Mpox, that treatments would be free of charge, I think it will encourage. But awareness, what you're doing now with your media station, I think is one of the great things, because the wider it goes out there, the wider people are aware that, okay, there's something ongoing like this. If I see my neighbor, if I see a friend, if I see myself coming down with these symptoms, there's need to report to the public health. So most times I want to disabuse that that in our mind, that we should wait for the government to do things for us, like proper treatment. And if we can afford it, first, let's come forward. Secondly, let's attempt to treat, because we have to stay alive, right? And I believe that the NCDC, I'm believing, and the Nigerian government would definitely come up with reference centers that treatments would be proper for Mpox free of charge. That's what I believe, okay? Depending on the level of public health alert we're operating on. Like I said, it comes with economy, okay? Level of public health alert we're operating on CSM is as to that level where we have reference centers that free treatments are being given. Have we gotten to that alert level for Mpox? Only NCDC can determine that.
All right. While we may not know the exact level, alert level that Nigeria has got into, as you said, is left for the NCDC to tell us about that. While there should be free treatment, or we think that there should be free treatment for persons who come down with the infection, what about diagnosis? During the COVID-19 pandemic, if you recall, at different centers, even in public places, in markets, there were public health officials there that were offering free diagnosis. People could come in and test to see if they have COVID-19 infection. Should we begin to awaken such to ensure that, first, people are being diagnosed. And so we know those who have the infection before we're talking about treatments, because if people have to get to the hospital or have to be sick before they get to the hospital, that means that they've been exposed to more persons who perhaps may have also contracted the infection. What should we do about that? And secondly, in terms of public health, what's the collaboration with environmental specialists, environmental health workers, to ensure that people know what to do regarding their environment to keep these animals that spread this infection far from them?
Oh, okay. Oh, thank you very much. So I'll start with the last one. So like I said, there's a technical working group, okay, at the EOC there in NCDC, and the technical working group is not just one profession, okay, it's a One Health concept, meaning there's collaboration between the Ministry of Health, Ministry of Environment, Ministry of Agri, other ministries, other sectors, okay. And so if the Ministry of Environment has been onboarded, you'd expect that, okay, environmental sanitation, like it worked or it works for Lassa fever. If you see a strange animal, okay, report or don't lose your food, do the basic environmental ethics that will keep diseases away. Okay, so I believe that the Ministry of Environment are doing that, as well as Ministry of Agri, that have been training or informing veterinarians, area veterinary officers, and I believe those ones, they are aware that if there's an animal that is like monkeys, like rodents, okay, that is in the environment, mostly they already know, just like in Lassa fever, we have a specific multi-mammal rat that would spread this infection. So when you know it's pathognomonic, you know that this guy is coming as a carrier. So the awareness is not just monkeys, not just strange animals. Animals generally, they carry thousands of viruses, bacteria, parasites that can be zoonotic, that can be transmitted to humans. So even when you keep pet animals, it's very important that you make sure that they're up to date with their treatments, with their vaccinations before they're even your pet animals, because I don't want to even sound so deep. Sometimes there's this concept of abortion in humans that is just from the force, from some organisms that are found at the force of cats. Okay, so toxoplasmosis. So I'm just saying there are a lot of things that animals come with. How much so the ones that come from the forest that you're not even familiar with. So in terms of diagnosis, right? Just like doses are coming into now, I'm aware that diagnostic kits, diagnosis in different level. One, you have diagnosis, just the rapid test. The rapid test is just so to initiate immediate treatment or not. The advanced test, which is the PCR is the one that would confirm that this is a true case of Mpox. Not just confirming that it's a true case of Mpox, it tells you the clade, meaning the strain you're dealing with. Okay, so I feel that what they have at the point of entry, since there are surveillance officers, you can't conduct surveillance if you don't have diagnostic kits, right? So at least you're expected to have diagnostic kits for rapid tests, right? So I believe they have RDTs at the ports of entry, and maybe when the symptoms start revealing, they collect samples for further lab analysis at the National Reference Lab or IRUA. I'm not sure if IRUA conducts tests for monkeypox, but very rightfully said, like he said, there's the maternal transmission. It's been reported in science. In fact, the very first case of Mpox in humans globally is in a 9 months baby. So that has been reported. I'm not aware of how they break the chain between the maternal and the neonate so that it's not there's no vertical transmission or horizontal or however you want to look at it. But that would be very interesting if we can prevent that.
Thank you very much, Dr. Polycarp Salam Samson, for joining us on the program and, of course, giving us insights. And yes, at some point I tried to sound as intelligent as you are, with the conversation. But it's been a pleasure having you, extensively bring us up to speed with the state of things and how we can actually prevent the spread of monkeypox in Nigeria. We're hoping that when we
It's my pleasure.
call on you again, you'll be able to respond and, of course, provide us with more clarity on the issue of monkeypox and some other conversations that might come up.
Sure.
Early exchange, shaping policy, advancing development.